we've been able to get people in focus for a long time with laser vision correction to correct the short-sightedness, long-sightedness and astigmatism. But what we've not been able to do very well is also restore close vision. Because in some ways they'll think, well, it's kind of a failure, I still need glasses. With PresbyMAX, we can now treat these patients in a way that will give them predictable, functional range of vision without causing harm, and that's really important. So to me, the ideal patient is that patient who's approaching 50, is a little bit out of focus already, and then motivated not to need reading glasses. PresbyMAX will restore a range of vision that is functional, so patients can function without being dependent upon glasses. But it's not going to take you back to how you were when you were 25 or 30 years old. And that's probably the key message that I'll give to a patient, is that I can give you functional vision so you'll be able to go through most situations without glasses, but you may still need glasses sometimes. I'm kind of tricking your visual system. I'm not restoring your natural vision like it was when you were 30. So you have to accept that even though you'll be able to see, you'll find yourself perhaps wearing reading glasses sometimes for difficult situations when it's poor light or very small print, or for prolonged close vision tasks perhaps. PresbyMAX is the SCHWIND software that they developed specifically to treat presbyopia, the loss of close vision. I've been involved in this kind of treatment now for probably almost 15 years. I worked with another company for a long time with a similar kind of software profile, and we liked that and it worked pretty well. But then I came to the SCHWIND family of lasers, and gives me as a surgeon a lot more flexibility in how I can customize the PresbyMAX treatment to the individual patient, which is really important. So some patients just don't want to wear glasses. So I'm going to push a little bit more aggressively and give them greater depth of focus. Other patients want the sharpest possible vision and maybe just to reduce their need for glasses for computer screen distance, intermediate vision. So I can then modulate how much induction of depth of focus I do with PresbyMAX to match what the individual patient wants. Now that sounds complex, but what's going to come out today in the talks is PresbyMAX can actually be an incredibly simple thing from the surgeon's perspective for how they use it. Once they hear about it and look at the software and just kind of get their sense around what it can do, it'll just become a standard. There's no reason not to do it really for those patients in the group where they're approaching presbyopia.